Okay, Brian. So here in clinic, we always want to be patient-centric. Patients, that's why we're here, right? And we have to treat them as who they are, unique persons that we have to tailor our care for. So when we were devising the standardized work, we wanted to standardize everything to really focus on that interaction with the patient. Okay. So I want you to think about that when we're actually going through the actual standardized work.
Sure.
Okay. And the standardized work, also think about it as the current best way of thinking. It's not a final document. There's never the final version. It's consistently changing to make sure that we keep up to date the best practices so that we could minimize the wait for our patients and offer the best service possible for our primary care patients. So let's take a look.
Absolutely.
You can see as a general, there are multiple steps here, and some of them have ORCID steps, and some of them don't. And what that means is that each step, from when the patient comes in and is ready to be seen by the provider, is clearly documented of how to best approach that encounter. So let's look at step one. It's an ORCID step. Receive verbal notification from the nurse or the medical assistant while the patient ready for the physician. And if it's not received, you can always refresh. So if you're at the computer, you could refresh the screen and to see that the patient has been seen by nurse, indicating they're ready to be seen by you. Okay. Pretty straightforward, right?
Yeah.
So here's step 20. You're done. The patient's ready to go, and now it's your time to actually verbalize and communicate with the nurse. So what you do is remember the flags. Flip that red flag to orange, indicating that the patient's in the room and ready to go. Just they are waiting for the nurse for the discharge. And then last step 21. Have that verbal discussion with the nurse. Close the loop in communication. And there they could even let you know, like in step 1, Dr. Barry, your next patient's ready to be seen.
Sounds pretty straightforward.
Any questions?
No, I think I got it.
So now that everyone's trained, all the providers, nurse practitioners, residents are trained in the return visit. What we try to do is audit to make sure we're all adhering to the standardized work. Again, this is not a final document. It's the current best way of approaching the patient encounter in the return visit. So the way we make sure that happens is through our audits. Would you like to go over and take a look at the whiteboard to see how we do the audits?
Sure, let's go.